Okay, for this evening's 12 on Health Report, brace yourself. We have the after pictures, part 2 of the mini facelift surgery we brought you yesterday.
Plus, the lowdown on what it all costs. News 12 Connecticut's Gillian Neff was in the operating room while the surgery was performed. We're going to give her kudos for that. She's going to tell us all about it.
With me. I'm fascinated by this stuff. And I was in there, and the mini facelift surgery didn't seem terribly bloody or scary, but I'm told that the images are pretty graphic, especially to people who get uncomfortable at the sight of blood or surgical incisions, or people who are having dinner. So fair warning, we're about to show you some graphic video.
The whole thing's an artistic judgment.
If plastic surgeon Dr. Joseph Brad O'Connell were an artist, on this day in the OR, patient Carol Dowd would be his muse.
A little bit, and just, help this section.
Both expect strong but subtle results from an advanced procedure, mini facelift, technically called short scar facelift.
There's about half the scarring involved, with about 80% of the success.
Our goal is really to correct mid-facial descent and the problems in the mid-face. Our face deflates, and it's almost like a balloon. It deflates, and then because it's deflated, what's over it, meaning the skin covering and the soft tissue on top of it, just sort of droops.
The canvas is challenging, though.
Yeah, turn Carol a little bit to her left. Great. Okay.
Carol's face is quite thin. Dr. O'Connell has to be painstakingly precise, remove just tiny amounts of facial fat and other tissue necessary to restore a more youthful look.
Tightening from the inside and then redraping the skin over it.
Dr. O'Connell releases ligaments to free the face before moving it.
Probably the thing we worry about to the greatest extent with a facelift is that the nerves that control all the motion of the face are near, but not terribly near, where we're working. And that's one of the reasons that we feel that board-certified plastic surgeons probably are the most qualified people to do this operation.
There are other risks, too, some that come with every surgery. First, the fine line between just enough and too much anesthesia.
Go back to sleep.
Then the risks associated with cutting.
The biggest concern with this surgery, from a technical standpoint, is bleeding.
Okay, Michelle, take the little hook.
Her other concern, infection. All avoided during this operation.
Okay, Lucy, all set with the O2 candle?
That's great.
Now it's time for the after picture. Take a look at Carol.
It's been 3 weeks. I could probably pull my hair back today and not have anything visible.
She's avoided the scars of a full facelift and, in the process, avoided full anesthesia.
Is that she doesn't have a tube in her throat. She's breathing entirely on her own, and she's controlling her vital signs. We're not.
Also, Carol says she experienced virtually no pain, just some discomfort, and recovery was faster than expected.
I had the surgery on a Tuesday, and on Monday I came back to work.
You may be wondering what I am. How much does all of this cost? The mini, or short scar facelift, costs about $7,000. Lower eyelid lift, $3,000, and laser resurfacing of the upper lip, about $1,500. A gift Carol bought herself for her fast-approaching birthday.
I'm ready to celebrate.
But don't expect her to embrace 60. With or without a rejuvenated face, she steadfastly dreads it.
It's ugly.
The number may be ugly, but the face isn't.
But I'm looking good, I think.
Of course, it's not for everyone, but if you're considering plastic surgery, some advice from Carol and Dr. O'Connell. Find out in advance if the surgeon is board certified through the American Board of Plastic Surgery. And we have a link to the board on our website, news12.com. Just click on the numbers and links on the left side of the page. What do you think?
She recovered so quickly. Surgery on Tuesday, back to work on Monday?
Our producer said, she's so pretty to begin with, she didn't even need it,
Absolutely true.
Some people would think, don't even go that route, but...
She feels better about herself.
She loves it. She's so thrilled.
I'm so glad you showed us the after pictures. It's reassuring.
It was all worth it.
Oh, yeah.
Thanks, Gillian.